Picky eating is certainly very common among kids. You know that at your dinner table. But how do you know if it's actually gone too far and become an actual eating disorder?
Here now to talk with us through this subject matter is Dr. Saunders, a child psychologist at the Institute of Living. Hey, Doc, how are you?
Hello, friends, and happy Wednesday.
Happy Wednesday to you.
Happy Wednesday to you, too. So is this just like, I mean, I have a picky eater and I have a good eater. So, like, it's kind of normal for kids to get weird about food not touching or texture. Like, that happens in most children?
So this is what I wanted to bring up, and I want to thank my colleague, Dr. Sandu, at Connecticut Children's Medical Center for providing me with some of these talking points. But I think that it's really important to understand that there's a difference between a picky eater and what we call ARFID, which stands for Avoidant Restrictive Food Intake Disorder. Now, it's not uncommon that kids are picky, but this is a more extreme version. And often what happens is parents become overly accommodating because they, with good intentions, want their child to eat. And so therefore, if your child only eats, McDonald's chicken nuggets, they'll get McDonald's chicken nuggets for them for every meal, for every night, instead of trying to push the limits and have them try different foods and be exposed. But so there's picky eating, and then there's avoidant restrictive food intake disorder, which is where it's a much more extreme avoidance, or they have a much lower intake of food.
So at the dinner table, when I was growing up, you either finished it or you didn't get up. I mean, is that...
We're not supposed to do that anymore. We're not supposed to tell them to clean the plate every day.
Is that not the case anymore?
Right. So that's not really good, because that kind of sort of force feeding really creates more aversive experiences, and it really turns a lot of people off on food, and so much so that you really remember it, and remember it as a difficult experience. ARFID is really marked by a fear of aversive consequences. Often these individuals have a fear of nausea or fear of vomiting, and that fuels the low appetite. They have extreme sensory sensitivity, so they don't like the color, the texture, the smell, the taste. So it's really much more extreme. So it's for those kids that are picky eaters, it's about encouraging them to try new things. And you don't have to eat the whole plate, but you can try one bite. And if you can't even finish it, that's okay too. But it's the act of exposure that really helps this.
So, yeah, one might be like, all right, I don't want to try, I'm afraid to try broccoli or whatever, and that's just exposure. But if it's someone who's like, I can't eat because I think I'm going to throw up, or I think this horrible thing's going to happen to me, that you might need some professional help, and they do actually have treatment. How do you treat this eating disorder?
They do have treatment. So, yes. So the ARFID, the psychological signs of the avoidant restrictive food intake disorder is, fear of choking or vomiting, lack of interest in food, extremely picky eating that becomes worse, really limiting food intake to particular textures, and complaints of stomach upset or feeling full around meal times. Now, a lot of those are I'm not saying that those kids don't feel full or have upset stomachs, but a lot of it's psychologically based. So there is treatment that includes cognitive behavioral therapy with a specific exposure, focus on exposure and what we call response prevention. So it's taking a bite of something that seems uncomfortable, and, maybe the first try it's not even swallowing. It's just taking a bite, chewing it, and then spitting it out. So it's doing things that increase the exposure. It actually is very limiting as you become an adult to have such severe food restrictions. And what we're talking about is, folks that maybe eat like 5 foods, right? That's very severely restrictive, and that is really bordering on like an ARFID.
We only have about 30 seconds left, but is this more prominent in men or women, boys or girls, or?
It's not necessarily more prominent in one or the other. There is some kind of genetic loading that seems like picky eaters seem to breed picky eaters. But really, if there's a risk of a nutritional deficiency or imbalance, you do need to seek help and seek treatment. Connecticut Children's Medical Center can help with that.
Okay. Terrific. Good to know. We have some experts right here in our community. Thanks, Dr. Saunders. We'll talk a little bit more about it on Kara's Cures on the podcast.
Have a great day.
All right.